It's important to have a basic understanding of the anatomy of your lumbar disc so that you can feel empowered to manage your pain. And without any knowledge, you can actually be left helpless, confused, and frustrated by the fact that you're not recovering any faster. And so the most commonly referenced food analogy is the jelly donut, meaning that the jelly like substance in the middle of your spinal disc, which is called the nucleus pulposus, is actually housed and surrounded by multiple layers of connective tissue, like the cake part of a donut, which is called the annulus fibrosus. This jelly will actually move towards the path of least resistance and least pressure, which means that if you bend forward, the contents of that disc is actually going to move backwards and vice versa. And if the force is sustained for too long or the force is generated too quickly, the contents of that jelly can actually push out against those fibers, resulting in a herniation or bulge. And so this can irritate the connective tissue itself, disrupt the mechanics of the spine, and put stress on some nearby nerves. Moving in the opposite direction that actually causes the herniation is thought to return the disc back to its normal shape and help with recovery. So two of the most common exercises to reduce a herniated disc are press-ups and standing backwards bends, also in the motion called extension. However, a research study in 2017 showed that even with pain relief following these exercises, the extension-based exercises, the spinal discs were actually still herniated, which brings up the question if the discs were actually the true cause of pain in the first place. The reality is that disc herniations and bulges are just a normal process of aging, and it's not always the cause of your pain. So stay tuned for more.